Good afternoon, everyone. My name is Teo Reyes. I'm Deputy Director of Programs and Research at Rock United. Thank you all so much for being with us today, and welcome to Rock United's first national online rally. I know it's a little unusual because it's a virtual rally, but we're very excited to have everybody here, and we're pushing forward with our fight to improve wages and working conditions for restaurant workers around the country. We're very excited that in a few minutes we're going to hear from a great series of speakers, including Senator Elizabeth Warren, Judy Gonzalez of the New York State Nurses Association, Don Huckleberry of Paid Leave for All, and several of our restaurant worker members from around the country. Before we start, I want to encourage everyone to text ROCK, that's R-O-C, text ROCK and text at 79606, again 79606, to show your support and join our cause. And feel free to drop any questions or comments under the Facebook Live or tweet your questions to us, tag at Rock United, and let us know if you're an essential worker. And for the media, please write any questions you may have in the Q&A box on your screen. All right, so everyone, if you want to turn on your cameras, shake your banners, shake your signs, let us know you're here with us. It's fantastic. We're so excited to have everybody here today. All right, let's turn the cameras back off. We're going to proceed. We have Senator Warren joining us in a few minutes, so we're going to turn the cameras off. Por favor, apaguen los videos y vamos a continuar con la presentación. All right, everyone, let's welcome Sekou Sibi, who's Executive Director of Rock United. Sekou, please join us.
Thank you very much, Theo. And I'm truly delighted to see everyone here, supporters, partners, and restaurant workers that we serve. Over the last 2 months, all 50 states have partially or completely shut down their bars and the restaurant. And as a result, millions of restaurant workers have been thrown out of work. We are here today to call for the much needed protection that the restaurant workers deserve in the time of this public health crisis. For restaurant workers that are fortunate to keep their job, they need more than ever the safety equipment or PPE and premium or hazard pay. They are risking their life and putting their family members in harm's way. And for those who are currently out of work, restaurant workers need paid sick leave, paid family and medical leave, and income relief to be able to put food on the table, as well as the guarantee that they have a job to return to when the restaurant opens. We are also here to pressure Dine Brand, the parent company of Applebee's and IHOP, provide protection for workers. In late March, Rock United launched Applebee'sIsRotten.com, a website which enables worker advocacy with Dine Brands directly. Workers from across the country have sent over 500,000 messages to the company, calling on the company to support those who have been impacted by COVID-19 and permanently provide paid sick. The vast majority of restaurant workers employed by Dine Brand have no access to paid sick and do not have sufficient people to put the sick employees and customers at risk. Specifically, of almost 2,000 Applebee's across the country, only 69 corporate owners have been given temporary and accrued paid sick. As some states start to reopen business and more workers return to job, Dine Brand is recklessly jeopardizing the health of workers and customers by failing to provide this essential protection. On behalf of Iraq, we strongly urge Dine Brand to do right by the employees and give them the resources and protection they need. It shouldn't take a global pandemic to provide these benefits. They must become the standard now and into the future. I pass now the mic to you. Thank you.
Thanks so much, Sibi, for that. That was great. We're very excited to see that Senator Warren is with us. I would like everyone to please turn on your cameras and show, wave your signs and banners. Por favor, todos prendan sus cámaras y muestren sus carteles. Muchísimas gracias. Thank you, everybody. We are essential workers. Restaurant workers are not disposable. And beyond gloves and masks, we need paid leave and income relief. I'm going to ask everyone to right now, turn off your videos so we can continue with the program. We're so excited that you're here with us. Senator Warren. I'd like to now invite Andrea Pentabona, who's a bartender at Back Bar in Boston, Massachusetts, to give a quick introduction.
Thank you, Teo. Welcome, Senator Warren. My name is Andrea Pentabona. I'm a bartender at Back Bar in Boston, Massachusetts, and a member of Rock United. I have worked in the restaurant industry for more than 20 years. As a mother to a beautiful 4-year-old daughter, it's been extremely difficult since the bar closed and I lost my job. In these times of health and economic crisis, my coworkers and I are desperate for all protections we need: guaranteed paid leave, income relief, the assurance that we have our jobs when restaurants and bars reopen, and adequate personal protective gear when I do go back to work. May 1st is a special day as we commemorate Workers' Day around the world. And it is also special because for the first time with Rock United, we have Senator Elizabeth Warren with us to speak about the Essential Workers Bill of Rights, which she introduced in Congress. Without further introduction, on behalf of Rock United, it is my honor to welcome Senator Elizabeth Warren.
Oh, thank you, Andrea. Thank you so much. And it's good to be here with Rock United on May 1st, on Workers' Day internationally. I'm so glad to be with all of you because I want to talk about something you understand firsthand better than maybe anybody else in the country. And that is the importance of doing right by essential workers. So just pause for a minute and think about who essential workers are. As you know, doctors and nurses, that comes to mind. But it's also the people who are cleaning the floors in the hospitals. It's the people who are stocking the grocery store shelves. And it's the people who are making deliveries, who are continuing to keep restaurants open for takeout where that's possible. It's the people who are keeping our country going in the middle of this pandemic. And as many of you know, it is disproportionately women, it is disproportionately people of color, and it is disproportionately low-wage workers. So my view on this is we've discovered who's essential in this economy, and it's the people who keep us healthy, who keep us fed. And that means they're out there on the front lines. If they've got our backs, everybody else in America should have their backs. So that's why I put together something called the Essential Workers Bill of Rights. I introduced it in the Senate. Congressman Ro Khanna did this in the House. And here's what it's all about. First, it's about the health of everyone who's still showing up to work. It says they have to have, and the employer has to furnish at no cost to the employee, full protective gear, whatever is appropriate, masks, gowns, whatever it is that people need. And anyone who's showing up to work in this crisis gets full health care coverage. Because if someone gets sick, we want to know it's not going to bankrupt them. So that's critical on the health front. But it's also important that we're backing up our essential workers on the economic front. So part one is that workers who are still showing up to work right now, our essential workers, should get hazardous duty pay. They should get a bonus for being on the front lines. In addition, they should get paid family leave and sick leave. If they need to be out sick, they should still get paid. If they need to be out to take care of a child or an elderly parent, they should still get paid. And Rock United will understand this. The Bill of Rights also includes worker protections. So anyone who's not unionized would have the right to join a union. Anyone who's already got a union contract will see that collective bargaining agreement respected. And any worker who wants to raise an objection, a whistleblower who says these are not safe conditions for me, would have his or her job protected. You know, a lot of folks right now are looking around, people who have not been in unions, and saying, I need help, I need protection, I need somebody who's going to be on my side in the middle of a crisis, and somebody who's going to be on my side all the time. So that's what we put together, an Essential Workers Bill of Rights. And I want to underscore one more part to this, and that is this is not called an essential workers, oh, we're going to give them a gift out of the goodness of our hearts. Nope. It's the recognition that you're out on the front lines, and that means you're making this country work and you're keeping the rest of us safe. And when that's the case, then we should make sure that you're safe and that you're getting compensated for doing that. So this is a Bill of Rights. It's what's right for people who are out there. And here comes for me the best part. We pass legislation like this in the next coronavirus package. It is a good reminder of when workers stand together, what we can get done. Because for me, what's in the Essential Workers Bill of Rights are the kinds of things that should be there for all workers all the time. Protection of your rights as a worker, economic protection, and making sure that everyone who goes off to do a job has a chance to do that job safely and to get fairly paid for it. So if you believe in that for yourselves and for other essential workers, I'm asking you, please use the hashtag Stand with Essential Workers. That's hashtag Stand with Essential Workers. Because if we all stand together, especially on May 1st, then our voices will be heard in Washington, and we will protect the people who are protecting us. So thanks for having me here today. I'm grateful for this opportunity. There's nobody I'd rather be with than Rock United, folks who understand the importance of our essential workers. Thank you all.
Thanks so much, Senator Warren. It's a pleasure to have you with us. I'd like to ask everyone to turn your videos back on, and in lieu of a chant, because we're doing a virtual rally, please show us your signs. Por favor, prendan sus videos, muestren sus carteles. Restaurant workers are not disposable.
Yes.
Trabajadores de restaurantes son esenciales. Muchísimas gracias. Thank you so much. This is fantastic. If everyone can turn on your cameras, continue showing your signs, and now let's turn them off and switch off. So now I'd like to hear. Thank you so much. We're Rock United. It's a tremendous pleasure to have you with us.
Thanks.
Thank you. Senator Warren, it's very different. It's of course, this is a very unusual situation to be in a virtual rally. It's the first time we've had to do something like this, but we're very glad to have you here with us, and that you're able to show and give us inspiration. And we've been fighting around the country both to provide restaurant workers basic economic rights, make sure they're getting financial assistance. Many of them have been thrown out of work with absolutely nothing to support them. And so we've been glad to be out there fighting to make sure that workers have these basic rights. At Caribou Coffee, we've been able to hit hazard pay and some additional advances, and we've paid sick leave at a few other major restaurant chains, and we want Applebee's and other chains to do the same and show that this is possible for all restaurant workers around the country. So Thanks so much for your leadership and your support.
Thank you, and stay in the fight.
Thank you. All right, so thanks so much. Now we'd like to hand it over to Jim Conway, who works at Olive Garden in Pittsburgh, Pennsylvania, and is a longtime member of Rock United. Jim, it's a pleasure to have you here.
Hi, good afternoon. I am James Conway. My last name is spelled C-O-N-W-A-Y. At 63, I've been a server at the Olive Garden in Pittsburgh for the last 16 years. On March 15th, without any prior notice, my coworkers and I were told that the Olive Garden dine-in operations would be closed as part of mandatory efforts to prevent the spread of the coronavirus. The management did not tell me when I may have a job again. Since I started working for the Olive Garden, Darden Restaurants, which is our parent company, has never provided me paid sick days or paid family and medical leave. I also never had health insurance from the company. I work about 6 hours a day, 4 days a week. My pay rate started at $2.83 an hour plus tips. And now, after 16 years, I get $2.83 an hour plus tips. A few weeks ago, as the coronavirus began, Darden announced that full-time workers can get up to 5 paid sick days. These are accrued paid sick days determined by the worker's length of service. But since I am a part-time worker, I would only be eligible for 15 hours or about 2 days. Darden also announced a 3-week emergency pay for those affected by the closure. While I applaud both these gestures, they come in response to the pandemic, and I think we all know this crisis will extend beyond a few weeks. I call on restaurants everywhere to invest more in their employees by giving paid sick days to all workers and paying tipped employees at least the full minimum wage. With the current restaurant closure, I am worried about the next paycheck. I have already applied for unemployment compensation, but it took several weeks to process. The situation is dire for most restaurant workers. I know that some of my coworkers have not paid their rent or their bills. But if I am called back into work, I need to go back in to have any source of income because I will lose my unemployment benefits. Yet this puts me in a terrifying situation because going back to work means greatly increasing my risk of exposure to the coronavirus. Before the restaurant closed, we did not have adequate PPE, and I don't have confidence we will get it even now. It is a cruel irony. We need to work for a paycheck, but doing so puts our life on the line. We should not be asked to work under these unsafe and possibly deadly conditions. As restaurants start to reopen soon, Darden, Dine Brands, and all large corporate-owned food chains in America must provide us the safety and security that we all deserve. All restaurant workers need paid sick and medical leave during a public health crisis. We need the protective gear and equipment that will keep us safe. And going into work is literally a matter of life or death. And we deserve the same protections and benefits that so many others across the country are afforded. The rush to prematurely reopen restaurants without the proper safety protocols and benefits shows how little regard there is for our health and safety. It is clear that there are some workers whose lives are valued more than others. That is just wrong. And I am here to say that my well-being is worth just as much as anyone else's. Why would restaurant and service industry people like me suffer the most? Unfortunately, the only answer in mind is that large corporate-owned chains prioritize their profits over our health and well-being. These food chains neglect their workers and let us struggle with meager income and no benefits, while they pay their executives billions, and that's with a B, billions of dollars in salary a year. It is now time to end that malpractice. It is time to support the Essential Workers Bill of Rights and call on these food chains to provide us paid leave and income relief benefits. It is time to provide sufficient gloves, masks, sanitizers, and other PPE. Having good health is a must, not an option. It is time to right the ship. Thank you. Theo, back to you.
Thanks so much, Jim. We stand with you, and we're glad of what we've won at Darden, and we know there's so much more yet that we still have to accomplish there. So it's great to have you with us today. So now I'd like to invite Jazz Solom, who's a server at Chili's in Sunrise Plantation in Florida, to come join us. Hi, Jazz.
Hey, Taro. How is everybody today? Happy afternoon. My name's Jazz. First and foremost, I would like to thank everybody involved inside and out for their continuous efforts to help our nation get through this rough time. Thank you to our healthcare professionals and our first responders for their selfless acts of bravery. And thank you to all of our essential workers. Also to everyone who is making a difference by just staying at home and staying safe. Thank you from the bottom of my heart. And thank you, Senator Warren, for everything. And thank you for listening to our concerns and hearing them. My name is Jessica Solom, but I go by Jazz. I've worked in the restaurant industry for about 20 years now. I'm essentially a career server, if you will. But on March 16th, I was furloughed by Chili's, which is a drinker corporation. It took me a week for my unemployment application to even get finished, and processing or pending is what it read until a month later I finally got paid. Florida has intentionally designed the unemployment system. It makes it difficult to receive unemployment benefits. As a result, my bills piled up and I waited for my claims to be processed. While people are talking about reopening the restaurants, I'm concerned that my hours will be dramatically reduced. I can't imagine how extremely difficult it would be for 50 plus workers at 25% seating capacity. Mostly probably I will get dropped from my health insurance, and fewer hours obviously means lower income. But as I also enter into the restaurant opening, I'm terrified about not having enough PPE. Without PPE, I'm practically defenseless against this illness. I don't want to feel scared to go back to work and possibly become infected and then transfer the virus to customers, friends, and family. Yet I may be left with no choice but to go back into this unsafe environment. It is disgraceful and a disgrace to see how recklessly we are moving toward this reopening. Restaurant workers are completely cut out of this discussion. Everyone is eager to get back to normal, but that brings different risks for everyone. For restaurant workers, normal in the middle of this pandemic means putting our health and safety on the line because we cannot do our jobs in the comfort of our own homes. I know this is a work or die or starve situation, and it's reality for many Americans right now. That is why restaurants should be required to offer the necessary PPE, personal protective equipment, before they can reopen. I know that the politicians and the business leaders calling for fast reopening would not want to put their family in this type of danger, so why should we have to? Health and safety on the job should not depend on income. It should be a universal right that is guaranteed to everyone. We are at the mercy of brutal corporate policies that are meant to maximize profits for executives. Well, maybe instead of restaurant executives making exorbitant salaries while we make below minimum wage, maybe we can get grants to go back to school or save our student loans. The system is broken for restaurant workers. We should not be treated as second-class citizens. Our lives are not expandable. We demand to have our health and safety protected. Thank you, America. Thank you, everybody. Thank you, Rock United. Y'all have a wonderful day. Stay safe. Take care of one another. Thank you.
That was great. And we know absolutely we have this conundrum. We want restaurant workers to want to go back to work when it's appropriate, and they want to be safe and protected, and we need to make sure that happens. We want to make sure that, first of all, everyone has the economic assistance they need to make it through these difficult times. And when they do go back to work, they're fully protected. Restaurant workers are essential workers. Please, everyone, don't forget to text ROC to the number 79606 to join our cause. I'd like to ask everyone to turn your videos on again, your camera on, and show your signs. Por favor, prendan sus videos, muestren sus carteles. I'm about to introduce the president of the New York State Nurses Association, Judy Gonzalez, and they've been leading the fight against COVID-19. And really, they've been on the front lines. It's a tremendous effort that they've been putting forth, and tremendous amount of leadership, and have been winning PPE for themselves and for everyone else. So I would like everyone now to turn off your videos, please. Por favor, apaguen sus cámaras. Judy, we're so lucky and happy to have you here. I'm going to hand the mic over to you. Thanks so much.
Well, thank you. So May Day is a day we honor workers throughout the world, without whom we wouldn't be able to have any of the materials and services necessary for life. But the irony of this day and every day is that workers, instead of being truly appreciated by our bosses and their political allies, we're exploited, we're disrespected, and we're endangered today and every day. No event made that clearer than the current pandemic we all face as a nation and as a world. As nurses and caregivers in the center of the pandemic in New York City, we had no choice but to take the lead in fighting back to save our patients and our community, fighting back to save our own lives and the lives of our families. In a nation that's politicized science to accommodate the needs of corporations, hedge funds, and stockholders, we had to study the science ourselves to seek out the answers on our own as we felt abandoned by our government, by the Centers for Disease Control, or the CDC, and that was an agency we once trusted, and our own employers. Of course, I'm talking about personal protective equipment, or PPE, as well as other social distancing protocols and other methods proven to be effective at isolating and treating infected individuals during a pandemic. Some say we entered this crisis with the government in denial. I say it was worse than that. There were too many warnings to justify that analysis. It was simply that those in power didn't care. They didn't care about frontline workers, they didn't care about vulnerable communities, and they didn't care about the millions of workers who would ultimately pay for their inaction. And this is consistent with their behavior throughout our history. The only time workers have ever won is when we fight. And so we fought. First of all, to contextualize the situation, after years of austerity imposed by a merciless neoliberal agenda, our hospitals who care for the poor and working class of New York, communities of color, the elderly, the disabled, the uninsured, the underinsured, Medicaid and Medicare recipients, and those suffering from mental illness, the incarcerated. In New York City and in other urban regions, most of our hospitals and health facilities were hopelessly overcrowded and understaffed. Rural healthcare suffered as well, with hospital closing in the state resulting in a loss of over 20,000 beds over several years. Suddenly hit with an extraordinary geometric increase in COVID-19 patients almost overnight, our metropolitan region hospitals turned into petri dishes of infection. Without appropriate PPE, we nurses became infected as well, some of us seriously ill, and some of us succumbed to the disease. And the rest of us became vectors, terrified that we'd pass it on to our families and neighbors. We went into self-quarantine to protect those around us. Some of us haven't even seen our kids or family members for nearly 2 months. Meanwhile, we faced deadly, and I mean deadly, repression at our hospitals and nursing homes. First, we were denied masks. We were actually threatened with termination if we were caught using N95 respirators. We faced outrageous shortages of gowns and face shields, and we still lack the safest respirators that the science has shown to be the most effective. And that struggle continues. But every step of the way, we fought back. We organized using all the virtual tools that we had to learn. We became overnight epidemiologists. We developed multiple reporting and communication mechanisms to collect data and share real-time issues and problems. We continue to hold Zoom calls and town halls on every possible tier of member, from shop floor to clinical center to hospital and to region. We held rallies using social distancing, prepped and supported our members to talk to the media without fear, hit back hard at any sign of retaliation, and realized our actual survival and the survival of our patients and our city depended on what we did to claim the narrative. This was the one time we couldn't strike, because if we did, people would die. So we had to be creative, but still be militant. Adjuncted to all of this, we decided to sue the state of New York through the Department of Health and 2 medical systems, one public and one private. We have no idea how the court will rule, but we know that the substance of the lawsuits represent the hopes and the possibility of salvation for health workers and our patients. We were compelled to engage in every form of action possible. And we continue to fight using our creative and working class juices, knowing that the real allies in this struggle are the members of our communities, without whom we couldn't have the early PPE that we did have through their efforts at GoFundMe pages, donations, sewing, cooking, serving meals, and assembling every night, which they still do now at 7 p.m. with a cacophony of musical instruments, pots and pans, shouts and song, honoring the sacrifice of not only health workers, but transit, food, delivery, home care, first responders, and all of us who had to adapt to the world of work without the supports to thrive and survive. And of course, our labor and union brothers and sisters. We're all suffering from pre, current, and post forms of PTSD. We've had suicides due to the overwhelming influx of death. At its peak 2 weeks ago, we were losing dozens of patients a day. We had to learn how to double shroud corpses, hold cell phones so that the dying could hear the last words of loved ones. We were told to stay out of the rooms due to COVID because it was obvious we didn't have adequate PPE, but we knew that our presence in the room was exactly what our patients needed to get better and to go home or to die with dignity. Not being able to do this, what nurses have in our hearts, is what is destroying our emotional beings. But most frightening is the thought that irresponsible government and right-wing mob mentality is pushing for loosening safety requirements, which will likely bring back the worst days of the pandemic. We can't allow it, we won't allow it, and we're not going to stop fighting against standards that endanger all of us. We also know it's not only about us, but all workers. Those who are essential, who are not working, must have life-saving PPE and paid sick leave, testing, and financial support. And those who have to stay home must have financial support, rent and mortgage relief, and family and social supports. We stand with precarious workers, unionized and not union workers, and rock folks who are fighting the same fight as the rest of us. There is no return to normal. The system is broken, and we, the workers, our community, our visionary elected leaders have to change things dramatically, have to change things now so that we can build a kinder and gentler nation and world. On May Day today, we have to shout it from the rooftops, out our windows, in any way we can, that our time is now. No more excuses. Our survival, our very humanity is at stake. Essential is not expendable. Heroes are not martyrs. Solidarity forever. Thank you.
Thank you, Judy. That was we're so glad to be able to have you here with us because you know I think you better than anyone. You know, your union has been showing the need for you know for people to go back to work in the safest way possible. And your experience is tremendously valuable to us, and your leadership as well. We're so glad that we were able to have you here join. That you were able to join the rally with us today. I'd like to now invite Dawn Huckleberry, who is Executive Director of the Paid Leave for All campaign. We're very proud to be members of that campaign. We want that is a basic benefit that all our members need and deserve, and all restaurant workers and all essential workers and everyone else around the country. So Judy, I'd like to, Dawn, I'd like you to join us to tell us about the Paid Leave for All campaign. Thank you.
Thank you. And thank you to all of you, to Rock United and to Senator Warren for being champions for workers, especially in this time. My name is Dawn Huckleberry. I'm director of the Paid Leave for All campaign, and I am here today because when the coronavirus hit, over 33 million people in America did not have access to one single paid sick day. 4 in 5 workers had no paid family leave through their jobs. This means that workers in this country lose tens of billions of dollars in lost wages every year. It means 1 in 4 people who give birth go back to work after less than 2 weeks. It means that today America is one of the only countries in the world where taking time when you are sick, when you welcome a new child, or when you have to comfort a dying parent, where that can cost you a paycheck or your job. And this means that we can't be there for the people we love. It means that we can't recover ourselves. And this has been a crisis for families and workers. This has been a national crisis for years in the making. But it took a pandemic for us to see it, to really realize that this hurts all of us, to realize that we need to be there for each other and that we are only each as protected as our neighbors and as our coworkers. But in March, Congress did take a big step. They passed a bipartisan bill to give emergency paid sick days and paid leave to many workers in this country. But it left out as many as 106 million workers. And who did it leave behind? It left out workers at the biggest businesses. It left out many restaurant workers. It left out workers bagging groceries, nurseries, janitorial staff, emergency responders, disproportionately women and people of color and low-wage workers. It left out the workers who are on the front lines now, many of you, risking your lives to keep us all safe, to keep the world going every day. And at Paid Leave for All, we say that's not acceptable. That is not justice. And we are all finally calling this work essential, and we are still not paying for it or protecting it. That is not how you fix a public health crisis or an economic collapse. It is not enough to say thank you. It is not enough to call any worker a hero. All workers deserve protections, and all workers deserve paid leave. At the Paid Leave for All campaign, we will not stop until every working person in this country has paid sick days and paid family and medical leave, because paid leave saves lives. That's always been the case, but it's really clear now. You should never have to choose between your life and your livelihood. So here's what you can do. Please call your member of Congress today. Visit paidleaveforall.org, where you can take action. You can literally hit a button and contact your representative. You can sign our worker petition. Please call your representatives and ask for the Essential Worker Bill of Rights, paid leave for restaurant workers, and ask for paid leave for all. Thank you. Thank you for all that you're doing. Please stay healthy and safe. Back to you.
Thanks so much, Dawn. We definitely, paid leave for all is something that we need to win, and we will win. We know it's doable. Many employers are offering it, and it's a travesty that so many large employers manage to exclude themselves from that language. So something we're going to continue to fight for, and something that all restaurant workers need. I'd like to remind everyone that if you have questions or comments, please drop them into the Facebook Live or feed, or tweet them at us with tagging @RockUnited, and let us know if you're an essential worker. Members of the media, please drop your questions in the Q&A box in Zoom. So our next speaker here is Hayden Smith, who's a restaurant worker in Nashville, Tennessee, and one of our ROCK members that we're very glad to have join us. Hayden, are you with us?
Yes, I am. Can you see and hear me?
Yes, fantastic.
All right. Happy May Day, everybody. First, I want to thank Rock United and Senator Warren and everybody for putting this together. I'm really excited to be here. My name is Hayden Smith. I'm a 10-year veteran of the restaurant and service industry. I was laid off in mid-March due to the coronavirus pandemic. My restaurant remained open almost to the last permissible minute. Reservations were being canceled en masse, and that last weekend there, walking through the mostly empty restaurant, buzzing the tables of the guests that did come, knowing there was a global pandemic happening, was terrifying. We all felt like we were just waiting to get sick. But I can't say for certain that was even the scariest part, because from there came the financial hit. There are few protections in place for hourly workers. I had to let bills go unpaid through March and April while I waited on unemployment. Thankfully, I am now receiving benefits, but I cannot say that for all of my coworkers. The system had failed us, or it had already failed us, and we were just now realizing it. But out of this, something beautiful grew. Workers all around Nashville began realizing that the only way we can lift ourselves out of this is together. Groups sprouted up all over, calling for collective actions. Through this, we all decided to come together and form the new Rock affiliate, Rock Music City. We aim to be a true worker center, with all of our motivations being driven by the wants and needs of our members. And right now, what we need most is safety. There is an invisible enemy that threatens our very lives, and we did not sign up to be sacrificial lambs. Tennessee is already allowing some restaurants to reopen in full service setting, forcing workers to return in an environment that has not yet been deemed safe by any public health experts. And we have to go. If your boss calls you and asks you to come back to work, declining simply for fear of catching COVID-19 is a reason to be removed from unemployment. And if you receive further payments, the state has made it very clear that you will be investigated for fraud. So if we are being asked to return, we feel we should have a say in what returning will look like. We just launched our Safer at Work campaign, and we'll be holding a press conference today to discuss that further. But our primary ask is simple. Reopening restaurants and bars should be based on recommendations by public health professionals and scientists, not lawmakers and business owners. Adequate PPE must be provided for all employees. If a business cannot provide enough PPE to keep workers safe, they shouldn't be allowed to open. Businesses must be required to disclose all positive COVID cases to the public, and workers who are exposed should be notified immediately so they can get tested and self-isolate. Following a confirmed case of COVID-19, all restaurants should close for a minimum of 24-hour period to disinfect and sanitize. Workers that do catch the novel coronavirus need to qualify for workers' compensation. And workers who are at risk or are caretakers of an at-risk person should be allowed to stay home and remain on unemployment insurance. A system of oversight must be implemented to hold businesses accountable. There are currently no governing bodies in place in Tennessee that have accepted responsibility in enforcing these guidelines. TOSHA and the health department have both said their offices don't have true enforcing power. And the governor has said that it will be on the consumer to enforce the measures by choosing where to dine. But without a mandate on to enforce restaurants to report cases of COVID-19, there's no way for guests to acquire this knowledge to make the informed decision. Testing and PPE supply need to be able to meet the demands before we enter phase 1. While hospital workers can't gain access to adequate equipment, how are restaurant owners going to be able to provide their staff with this? Finally, but most importantly, workers should have a say in any further measures their restaurant should take to ensure their safety. Every restaurant is different, and every restaurant has its own endemic issues that cannot be addressed by sweeping legislations. Workers need to be able to make their voice heard in these matters. We are being used as a canary in a coal mine. Public health experts say there will be a spike in cases after we reopen. That spike represents human lives, and whose lives will those be? They'll be ours. Thank you so much, Taya.
Thank you, Hayden. We're glad to have you with us. And it's, the situation faced by restaurant workers and other essential workers and healthcare workers is extremely dire. In our situation, we both need the financial assistance, having lost employment. 60% of unemployment claims, at least a few weeks ago, were from restaurant workers in the restaurant industry. So it's an industry that's been tremendously hit. And at the same time, people have to go to work every day, and they need to have, and the people who are essential workers and go to work every day, they need to have PPE to be able to protect themselves. So to that end, we're going to proceed to our Q&A portion here. And there's one question for community partners. So Dawn, maybe you can help us answer this. But the question is, what can we do for restaurant workers to amplify the need for PPE, paid leave, income relief, and all job protections, and to help make us feel safe and secure about the health and well-being of our families during the crisis?
Yeah, I mean, I think Judy and others may have good calls to actions really specific to PPE, but in terms of just providing, support for essential workers' rights and paid leave for all, you can go to our website, paidleaveforall.org, where you can click a button and contact your member of Congress. We can provide the number. There's easy ways. There's worker petitions you can sign. But I think there's a lot of, we're trying to consolidate as much as we can all the different resources for you to take action really easily. But this is a critical time. They're negotiating the next relief package, and they need to hear from more workers and more advocates. So please, please, please make calls, send emails, get on social media, anything you can to bring awareness to the protections that you need.
And Judy, would you like to add anything to that?
I think public displays are really helpful. Bring a coffin, say we can't, we can't work. This is our future without PPE. We find that whenever there's the media is hungry for stories. And I think when you do something really public, it attracts attention and educates people, and maybe name all the people who've died because we haven't had PPE, and there's many. And, this is not my future. My future should be raising my family, not lying in this coffin. Doing public events, knowing the science, and we can certainly tell you what the best PPE is to protect yourselves. Because it isn't just health workers. Our subway workers, many of them, more of them, I think, died than we did just by being cramped in subways, direct contact with people.
And just to echo that quickly, the storytelling is so important because, the media isn't getting it all. Certainly policymakers aren't getting it all. So any ways that you can find groups who can lift up, and we're open to this, I'm sure many of the other organizations on this call are open to this, lifting up those stories of what's actually happening on the front lines and what you need is going to be critical to making sure there are changes in the next bill that comes out.
Thank you, Dawn and Judy. We have a site we set up. It's called applebeesisrotten.com. And anyone can go there and look at all the stories that Applebee's workers have put on there, have added there about the struggles that they're facing. And we're pushing this campaign because they're one of the largest full-service employers in the country. And they've been part of that group that has been excluded from ensuring the safety and well-being of their workers. Another concern that we have is about the right of return. Essentially, one of the questions that came in has to do is, what is the assurance for millions of restaurant workers to have the right to return to their jobs when restaurants reopen? One thing we saw after Hurricane Katrina and after Hurricane Sandy and other disasters is that employers use that situation to then rehire different workers when they reopen, and we want to make sure that restaurant workers and all workers are able to return to their previous employer. So I guess if any of our members would like to speak to that, please do. I'd like to give you the opportunity. If not, just let you know that we're going to continue push that fight forward, and our plan for the next several months as states reopen and restaurants do reopen is to ensure that we have right of return in place so that workers are able to go back to their previous employer. So there is a question here specifically for Jim and for Hayden. Can you give us an update on what's happening with workers? So first, Jim, can you give us an update on what's happening with workers inside Darden restaurants or at Olive Garden where you're at?
Well, I haven't been to work for a month and a half, but just something that came out today. Governor Wolf, he's the governor of Pennsylvania, issued new guidelines for reopening restaurants, and it looks like the larger counties like Philadelphia and Pittsburgh is in Allegheny County will wait the longest to reopen, and they're saying 7 to 9 weeks. They have called me last week, and we're talking about opening up within the next couple of weeks, but as long as the Governor Wolf is saying we can't go in, nobody's going to go in.
And Hayden, is there anything you would like to add about the situation among restaurant workers in Nashville?
Yeah, right now in Davidson County, they have not allowed restaurants to reopen for full service. But in the neighboring Williamson County, where many of Davidson County's residents work, they are open for full service at 50% capacity. And fortunately, my restaurant doesn't fall under that, and we aren't opening until public health experts say it's safe. But one of the members of the founding committee of Rock Music City has already been called back to work and is having to weigh his options on if he can afford to not go and be taken off unemployment. Because with this also being historically a low-wage job, not a lot of us have savings. We don't have accrued paid sick days. We don't have accrued vacation time. So we've just been hearing from a lot of our members that weighing their options right now and trying to put a dollar value on their health, basically. It's a really, really sad situation.
Yeah, it's unprecedented, and that's part of the reason that we're pushing and fighting around all of these issues. Thank you, Hayden. I have a question here for Judy, and the question is, what is your advice to those who are just entering the health field during this crisis? The person who sent the question was about to start training as a home healthcare assistant, but now has been placed on hold. How can they still help or get training?
I think there's a bunch of online seminars that people can take advantage of. It depends on where you live and what unions are in the area. I know that we've put a lot of webinars and seminars together for people to get that kind of training. So I would look into that. I know about nursing, but in terms of home health, maybe an SEIU or PEF or one of the other unions that represent home care workers, that might be a start. And just start looking around for your own PPE is my suggestion to you. You can get a lot of it online now or get it. We're distributing. We got a lot of donations and we're distributing. So if you can find out about that, I would start accessing that material because they're not giving it to home care workers and other precarious workers to the extent that we're getting it because of the fights that we've been able to launch. So non-union workers are having a much harder time, as are people who are not directly in the hospitals. So those are the two things that I would suggest.
Thank you, Judy. And we have, the situation, of course, is dire with lack of access to PPE. At Caribou Coffee, our members there have won PPE along with hazard pay. They're fighting for more because they're concerned about having to work during the pandemic and not being able to provide for themselves and their families. But they did hold an action earlier this week, a drive-through action, which led to the company providing hazard pay and PPE. So we know we can make advances if we work together and we struggle together. Dawn, there's a question for you, which is, has paid leave for all addressed the lack of paid leave for major food chains such as Applebee's or IHOP, essentially the corporations with 500 or more employees?
It's the top of our priorities. So what we're doing right now in the very short term is Congress right now is negotiating the next relief package for coronavirus response. And what we are asking them is to fix the paid leave provisions that were put into an earlier package called Families First, which carved out businesses over 500 and many of you. And so that is at the top of the ask that we're making, is that they fix that and that they ensure that companies over 500 are included in this and their workers are protected. We're making a special pitch for all essential and frontline workers, but many of those fall under the 500 plus.
Right. Well, thank you so much, Dawn, and thank you for everybody who has joined us. I want to thank everyone who's spoken: Senator Warren, Dawn, Judy, Jim, Jazz, Hayden, Andrea. Don't forget, everyone, to text ROC to the number 79606 to get more information on how to join us in this important fight to secure safe and livable conditions for restaurant workers. For the people that are still on the Zoom here, if you can turn on your cameras one last time and show us the signs. This virtual rally, let's show what we've put together. Turn on your videos if you can. It's great to be here with all of you in this unprecedented time. We're essential workers. We are Rock United. Together we will win. We will improve wages and working conditions for restaurant workers. Thank you so much for being with us today. It's been a great pleasure. Our first virtual rally, our first National May Day rally. Thanks again. Venceremos. We won. Thank you. Bye.